surely have something to learn from this session. So I want to say a special welcome to Emmanuel Musa, all the way from Kaduna in Nigeria. Welcome to Tiala Kokpo, Monrovia, Liberia, Adunola Abodese from Nigeria. You're welcome. And I'm seeing, I may not read all the names because I see the number of persons in the room gradually increasing. So welcome Obina Chigbu from Kano, Nigeria. So right now I'm going to turn to Francois Gaz. We used to call him Mr. Anti-Tetanus for the fight that he led, that he made, for how well he fought the fight against neonatal tetanus. So he's going to just give you a welcome to this session. Over to you, Francois.
Thank you, Charlotte, and hello to everyone, wherever you are, whoever you are in this world and whatever time it is for you. I'm happy to be here with you because we're going into an area which is always a fascinating area, is getting ideas that can be helpful in the work that everybody does and can share and clarify the idea, show why they have this idea, what was a specific challenge they were fighting, why the idea could help the challenge, how they will implement the challenge, and how they make sure that the challenge leads to some results that were expected. So I think this session is the first time we have COVID in the context. So it's a lot of ideas that are new on the table and everybody will benefit, including Charlotte and myself. So we will learn from you. We will have participants asking questions about the idea. And maybe we will, with Charlotte, we will complement some of the questions for clarification or specificity, wherever we have questions to have the idea as clear as possible. So thank you and looking forward to the session.
Thank you very much, Francois. And I say welcome to Angela Kisoso from Kenya. Thank you for joining us today. Greetings to you, Jariatu Sal from Tana, Madagascar. And we have Mohammed from Kaduna State in Nigeria. We're so glad to have you with us here. Felicia Aibinomo from Abuja, Nigeria. And forgive me if I don't pronounce your name right. So just some few guidance as we start. We'll just invite you. There are some people that are typing to sending their greetings to all panelists instead of all panelists and attendees. So just when you want to type in the chat, ensure that you're typing to all panelists and attendees so that your peers will benefit from your comments, your contribution, and know where you're joining from. Also, we have the Q&A. If you have any questions, you can ask. There's a Q&A icon on your phone or on your computer screen. So you have any question, you can ask your question, and you can click on the like button, a thumbs up, to vote the best questions, and comment also on the questions. You can comment and you send the questions. So that was just for clarity. So what are we going to look at today? We are going to look at why are we organizing these sessions, and then we're going to invite one of you to introduce themselves and to share an experience with us. And then I'll be delighted to have Francois give feedback on the idea that you've shared and your peers also. And if there are additional questions for clarity, as Francois just said, we are going to invite you to answer those questions. So now, what's the objective? What's the purpose of these daily lightning sessions that we are going to be holding from every Tuesday to Friday throughout the exercise? We are here to share experience and discuss activities in the Peer Hub. And this will include what is a good practice or a good idea for the ideas engine. What can be a valuable idea that's worth sharing in the ideas engine that is going to be helpful and useful to your peers and yourself? How do you identify your challenge, the challenge you're to work on in the Peer Hub exercise in exercise 1? And how do you analyze your challenge and come up with good action steps? So as the days go by, as the week go by, we are going to be getting answers to these questions. And of course, as I said earlier, our sessions are every day from Tuesdays to Friday, 6 p.m. Geneva time throughout the exercise. And these are 30-minute sessions and they are optional. That is why I am through with talking. We have to take at most 5 minutes to talk, so that the rest of the 25 minutes, we know that within the context of COVID-19, you are very busy professionals. And so we wouldn't want you to spend more time than is necessary for everything. And yes, welcome, Reda, and thank you for joining this session. We're so glad that you could make it here. We know you just finished up with the meeting with the International Advisory Board. And so you're welcome, Reda. All right, so as I was saying, we are not going to take so much of your time. I am through. So I hope all of you yesterday evening, you received a mail inviting you to join the Ideas Engine. So I do hope everyone in the room has been able to join the Ideas Engine. And that is the place where that is for the next 2 weeks you'll be working on. Throughout this week, we want you to go through 7 challenges that were identified as those impacting immunization within the context of COVID-19. You identified those through the applications forms that you submitted. And so you go through them, you select one challenge that you think is impacting immunization in your context, and you write out an idea on how you can help meet and overcome that challenge. Welcome to you, Anike Rana from India. So right now, it is the time for you to talk, for you to share your experiences. The next 24 minutes will be for us to listen to you, to contribute, to hear you talk about your experience. And so far, I'm just going to, I'm seeing one hand that is raised, but it was raised a long time ago. I don't know if it's Nuhu Sani. So I don't know if you want to share your experience. Let me just lower all hands for the moment, and then I'll invite you, if you want to share your experience with us, I'll invite you right now to raise your hand, and I'll be delighted to ask you to unmute yourself and share your experiences with us. Oh, I'm so sorry. This failed to take, I failed to, I did a translation, and it's like I forgot to save it. So let me just rapidly, while you are thinking and raising your hands, let me just rapidly translate this question into English.
And Charlotte, I can say a couple of words in the meantime. First of all, very pleased that François Gass is here. For those of you who do not know him yet, he is probably one of the most seasoned, experienced immunization practitioners with that combination of science, field, analysis, policy, like the complete package. So we're very privileged to have him here with us to be advising you as you prepare to, and sharing his experience as you prepare your submission to the Ideas Engine. And as Charlotte said, the really we want to keep it simple, and we want to make sure everything in the Peer Hub is actually helping you. So this week, your purpose, you only have really one thing to get done. There's lots of other things you can do, but is to go to the Ideas Engine, think through a good submission, and it doesn't have to be an extraordinary, like game-changing idea that's going to change everything in immunization and defeat COVID. We're talking about the things you do every day and that you've been doing differently because of COVID. That's what we want to capture in the Ideas Engine. And do not underestimate. You may not think you're doing anything special. You're just doing your job. And there's a lot of modesty there. But in that modesty, you're actually facing up to the world's biggest challenge right now. And immunization is on the front lines. So tell yourself that what you are doing every day is what we need to know and share. The more people share, the stronger we will be and be able to find what are the ideas and practices that are helping to make a difference. And again, as I'm going to go back to Charlotte, yes, because we do want, this is the introductory session, but in future sessions, we expect at least 25 minutes. Will be those where you do the talking, and we will bookend to open and close, but this is your session.
Okay, thank you very much, Reda. So I am still inviting you, if you want to share your story with us, if you want to share your experience, your idea, what you have been doing, what you have observed being done, what do you want to share in the Ideas Engine, please raise your hand. And while you're doing that, I see there is a question on the Q&A from Abel Yannick Gilles Ehoni Ebanga. hello, I just want to know if I can express myself in French. I'm so sorry, Ebel Yannick. This is the English session. The French session is tomorrow at 2 p.m. Geneva time. And I hope you will be able to make it so that you can share your experience with us, because this session actually is meant for English speaking scholars. And unfortunately, if you express yourself in French, they may not be able to understand you. So I hope that is clear. So, on vous donne rendez-vous demain à 14 h, heure de Genève, pour la séance en français. Merci. Okay, so I'm still not seeing any raised hands, but I'm actually seeing on the, I actually shared the questions on the chat. So I'm going to share them again so that if they make sense with you. With the Francophone session, by this time we already had a scholar sharing their experience and story. So please, I'd just like to invite you to raise your hand, or I'm just going to invite, if you are here, it means there is a challenge you are facing, there is something that is happening in your context. So I may just invite you to talk about your situation, to share with us. So I'm just going to invite, okay, so I see Abdilatif. Can you unmute? Okay, now I have a raised hand. Thank you, Salu Shifero, for raising your hand. So I'll invite you to unmute yourself, and then you attempt to answer the questions. Salu, you have the floor. Please unmute yourself. All right, over to you.
Good afternoon, good evening. Can you hear me?
Yes, we can get you 5 on 5. So please, can you introduce yourself and tell us where you're calling from?
My name is Amsalu Shifarao. I am working for UNICEF Ethiopia. I'm from Addis Ababa country office. I just wanted to share you the recent experience of Ethiopia in conducting the measles supplemental immunization campaign and
all right,
how we did it.
All right, thank you. But before you do that, have you already been able to access the IGS engine?
Sure, yeah.
All right, that's great. So go ahead and you just follow the questions and tell us about your experience.
Yeah, I mean, actually, in the IDS engine, I have accessed and I have shared also our experiences, my experiences in continuation of immunization service in the context of COVID. But what I want to share now is the measles SI implementation process. So Ethiopia has recently vaccinated about 14.5 million 9 to 59 months children vaccinated for measles. This was done because of the increase in the number of measles cases across the country, and in many districts were also reporting measles outbreak. So this campaign was actually planned to be conducted in first week of April, but due to the COVID-19, it was postponed for 3 months. So what the ministry and the national team did is we revised the field guide to incorporate those issues that needs to be included for the prevention of COVID dissemination while vaccinating the kids. And we had frequent meetings at the national and at sub-national level. We also conducted a risk-benefit analysis based on the WHO guideline. And then this risk-benefit analysis was presented to the higher government leaders from national to the local level, and agreed to conduct the campaign. So we have conducted on the pre-campaign, intra-campaign, and then the post-campaign activities. In the pre-campaign, we revised the field guideline established technical task forces, and briefed also political and administrative leaders at all levels, and prepared terms of reference for the supervisors, vaccinators, and the task force at all levels. And the micro plan was also revised to include the supply and logistics that are needed to prevent COVID dissemination, including hand sanitizers, face masks, and then the hand washing facilities as well. And we have revised also the number of children that need to be vaccinated every day to minimize the physical distancing and overcrowding in vaccination sites. So by doing that, we extended the days of the vaccination. Initial plan was to conduct for 7 days, but it was extended for 10 to 11 days according to the local context. During the campaign, in fact, supervisors are teams are prepared, and supervisors are also assigned in every aspect. An extra of one health worker was included in the team to conduct COVID screening using infrared thermometer. If the thermometer is not available, they can also ask the signs and symptoms of COVID. And if they feel that this is more likely, the most likely suspected case, they refer for rapid response team who is following and conducting COVID test. But this was not done across the country, particularly in rural areas, but in urban areas, this was actually done. So at all levels, the monitoring was very strong, and every day there was a daily target and task force at health facility, at district level and at regional level was reviewing daily implementation of the vaccine, the progress, and if challenges are encountered, also addressing those challenges, including the supply distribution. This was a rainy season in Ethiopia. In some areas, there was rain, but vaccination team was told to be relaxed and take as much as more time to complete and then vaccinate each and every one of the child. So based on this, the supervisors were also conducting rapid convenience monitoring through going to house in selected children. And then in some areas, they have also integrated some few other services, including malaria diagnosis, and then the screening for other diseases as well. And then the challenges were, some of the challenges were, this was the rainy season, as I have said, and then particularly to reach in some of the remote villages and villages across the river, it was taking some time. And then in some areas also, there were security problems which delayed the vaccination for 2 to 3 days. And then in some areas, there was mismatch of supply distribution. I mean, the dry supplies were not provided along with vaccines, and it delayed for some 2 to 3 days. So this was, the experience that we had conducted, and it was actually the final outcome was, as I have said, 14.5 million children were vaccinated, and it is about 96% of the target, and it was a great achievement and lesson. Now we are supporting the Ministry of Health in documentation of the experience of conducting a measles SIA in the context of COVID. Thanks, and over to you. If you have any question, I can also try to answer. Thank you.
Thank you very much. Thank you very much, Amsalu, for sharing this experience with us and for the detail with which you shared that. I would like to invite Francois to tell to say what he thinks, the feedback on this on your experience shared, and if he has any additional questions for clarification. I just hope you just stand by, Amsalu. Over to you, Francois.
I'm speechless.
Wow.
Because I think it's a fascinating story that you have declared on Salu, you have described, and you went into a lot of very concrete details. And I congratulate you to be so specific on all the steps you took. So your idea was to implement campaign with all the challenge you have to have the decision, balancing the risk of COVID with the risk of the vaccine preventable disease like measles, getting a general consensus, which is the first fantastic step, using the guidelines of WHO, and implementing your plan in detail for a country of over 90 million. It's remarkable. Your achievement is really remarkable. And when you know all the challenge you can face logistically to reach everybody, it's fascinating. Your results are fascinating. And I hope you will have a chance to write down all the detail of this experience that could be very useful in many other countries and to document in detail. I have one, when you describe everything, you seem to manage the problems, overcome those challenges you describe, you are on top of things, you have a lot of infrastructure to make sure everything goes fine. One thing I didn't see, and I'm really anxious to hear about you. In many countries, in few countries where they have done the SIA's measles, there was very little attendance of mothers. They reached 50% and you reached 96%. You didn't mention how, if the sort of vaccine hesitancy from mothers because of COVID was a problem. Was it a problem only in urban area and not in rural areas? How did you overcome it? Because I think we didn't get a lot of the, how you did your, to calm the fears of mothers, unless there is no fears in Ethiopia. And it was just a question of offering the service everywhere.
Thank you so much. I didn't mention about the community demand. Actually, there was a fear or panic in the mid of March when the first case was reported in Ethiopia, and when the government was declared a state of emergency, and when the schools were closed, there was a huge panic among the community. Later, this fear has been decreased and disappeared in most of areas and in rural areas. So, with regard that we had also, most of us were skeptical. The community may not come to the vaccination side, but the reality was different. And the demand from community side was very, very, very great. So to bring to that level, I think the social mobilization was strong. The local media were used. The minister, including at the federal level, the minister was provided a media brief why we are conducting this measles SIA in the context of COVID. And there are regional medias as well, television, radio, and others. So the regional health bureau heads and higher officials were providing a brief. And there were every day in some places where the FM radios are available, the immunization experts were on live the whole day to answer the questions, the uncertainties. And even the community was saying the vaccinators were not coming to us and so and so on. So based on the feedback of the community, the strategy was also the strategy was also in some areas changed from fixed to semi-mobile fixed. The health workers were vaccinating a cluster of villages in the morning, for example. Then after they complete that village, they were traveling to the other village. So the communities were supporting, requesting, and mobilizing the target children, and it was a great. Even we had actually AFI case in AFI, in area where the AFI was occurred. I mean, there was some sort of panic on the family and in some sort of community, but they request, and the vaccination was at that site halted for 1 day and 2 days. But the community requested, we know this vaccine should be provided, but it is unfortunate that this is, a matter of chance. So the other kids need to take the vaccine. They were requesting like that, the local health officials.
I can, just one thing that you've not described is what kind of reassurance to mothers when your vaccination team coming to a village? Were mothers receiving masks? Did they prepare their masks? Did they have no mask, but just a distanciation? How did you address the safety of the mothers? With the
mothers were not provided with face masks. Health workers were using face masks, but there was hand washing and sanitizer at the site. But the most important one was maintaining the physical distance among the clients and spreading the number of the clients to small. I mean, there was no crowd in most areas. To reduce the crowd, the health workers, the team were moving from village to village. That was the one. Otherwise, there was no mask provision for the clients or mothers.
Even in town?
Yeah, even in town, they have their own masks. Particularly, for example, in Addis Ababa, all the caregivers had masks. Okay. And in big cities, they had masks. Okay. That is their own masks, not provided from the health facility. The health sector provided for vaccinators and volunteers and supervisors who are directly engaged with this campaign.
Thank you.
All right, thank you very much, Francois, and thank you very much, Salu. I see that there's a comment from Penelope Masumbu on the chat that says, thank you for sharing this experience. It provides insight for those of us who are preparing for similar activities in the context of COVID-19. And I can see there is one question also on the chat from Christina Gaberi that says, my question is if there have been any confirmed, any confirmed COVID-19 cases among people that attended the vaccination service and can be attributed to the attendance of the high number of people? And what was the reaction of other mothers in the community? It's maybe may not be directly linked to the experience you shared, Amsalu, but have you had such a situation in your context?
And we had no such incidents actually. As I have said, in most places, the health workers were using the thermometer, the infrared thermometer, particularly in major urban areas to screen the mothers. And there were a number of, I can't remember just now, there were a certain number of clients who were referred to the rapid response team for COVID test, but I don't have the results of those whether they appear to positive or not. Probably we can, confirm this from the Ministry of Health. But what I can tell you now is the COVID situation in Ethiopia is increasing recently. But
okay.
It might not be attributed to this mass campaign. There were also other events like the security issue and other issues. it is very difficult to attribute with this SIA. We need to have data for that. Over to you.
Okay, thank you very much, Amsalu. And I just wanted to ask you one last question. Concerning, you said the teams were moving from village to village. What special activities did you carry out in terms of vaccine conservation, that's cold chain maintenance during the immunization campaign?
Yeah, you know, in Ethiopia, there is a health extension program, the community-based health service. The health extension workers are assigned 2 health extension workers per 1,000 population, 1,000 households. So they know their catchment areas. They map their villages. They know where they are going to vaccinate today and where they are going to vaccinate tomorrow. And initially, they were also told to do enumeration of eligible children. So in some places they have registered the eligible children. In others, they took the estimated number using the conversion factor. So based on that mapping, they were split into teams, and the team were moving to cluster of villages. I mean, if you pull all the community into one place, some caretakers may have more than 1 children to be vaccinated, to eligible children for measles. So carrying 1 child, and then maybe one can go, but they can't go far places, they can't cross rivers. So it's better for immunization team to go too close to the community, not to miss those children. That was agreed at the local level and at sub-national level. Because of that, and the other one is to reduce the overcrowd and staying much in the immunization side. So if you go too close to the community, to villages, certainly you reduce the number of children who are gathering at specific place, and we can maintain the physical distance, not to disseminate the COVID virus.
All right.
Yeah.
Yes, Francois.
I have a simple question. Have you seen a drop in routine coverage in the urban area of the routine attendance of mothers to health facility for vaccination or not?
We have seen in March and April the drop of the routine vaccination, not only the number of vaccination or the coverage, but the health facilities that were providing immunization were declined in both in April and March. May data now we are analyzing, probably they will share today. The ministry is monitoring monthly data.
Yeah.
So May and June, we are going to look forward, but there was a reduction particularly in March and April, including the health facilities that were providing immunization were not providing immunization, reporting the immunization service in both months. But we are going to look at May and June report soon, this week.
Okay, thank you very much.
Thank you so much, Amsalu, and I'm seeing the questions and the comments are just dropping on the chat, and we are 4 minutes over the time, 30 minutes set aside for this session. But I just think that since it's our first session, it will be good to give the opportunity to those who have had their hands raised for a long while to just not necessarily share their experience, but tell us what they have, what the impressions that they have concerning the story that they have heard today. So Nuhu Sani, will you please unmute yourself? Your hand has been raised for a long while. And while Nu Samni or Adamu Ali are trying to unmute themselves, I would just like to read another question. It say, thank you for sharing the information. It's very reassuring and encourages us to have an absolutely no excuse attitude towards vaccination. So as we had said earlier, one of the reasons why we are having these sessions is for you, that is when you listen to the stories of others, you'll be motivated not to give up, but to continue to struggle, because we are not alone in this battle against COVID-19, and we are not alone fighting for the immunization of our children. All right, and thank you, Yen, for responding to some of the questions on the chat. There is Eden, vous avez écrit en français. Est-ce que vous pouvez avoir la version en français? Les séances en français tous les jours à 14h heure Genève. Et il y aura des enregistrements qui seront partagés avec vous. Merci. Okay, so that said, I don't know, Reda, are you having, is there something you wanted to add before we get maybe some parting thoughts?
Thanks, Charlotte. First of all, great, amazing discussion, as François said. And I hope it has remarkable example. I look forward to seeing your submission to the ideas engine to actually spell out, and it is what stays. We have an expression that says what stays is the written word. So it's great to share in a session like this, but what's super important is to get that in writing so that it can be shared and show other people that it's possible to do this, and how you actually manage to do it. The specifics will be important, and for everyone who listened to it, think it does however small or big what you have been able to do in the last few months. It's by sharing it, even if it doesn't seem exceptional to you, it probably is. And so we need you by the end of this week to kick off the peer hub, to have shared your experience in the ideas engine in writing. And also, if you found this session to be useful, share with people in your country group, explain to them what this is about. If you have colleagues that you know are in the peer hub, tell them about it. There is strength in numbers. The more we share, the stronger we will be, and the more we'll be able to know what are the ways, what is actually working in terms of adapting to the pandemic, to maintain immunization services, and maybe even do better than we did before the pandemic. Thank you, Charlotte, and François, and Adam.
Thank you very much, Reda. And I really want to read this comment that came in on the chat. Say the experience shared seems to confirm the positive impact of community health worker programs in strengthening health systems and sustainability of routine services like immunization. I think that's a very good comment that has been expressed in an excellent way. Okay, so that said, I want to just thank you all for being there today and invite you, please share the ideas on the ideas engine and be there tomorrow for tomorrow's sessions. Just a recall of the sessions that we have this week: Wednesday, Thursday, Friday, 6 p.m. Geneva time here on Zoom. And then also remember to join tomorrow's technical session. I just muted Adamu Ali, sorry. So remember to join tomorrow's technical sessions with Alain Blaise Tatinku at 11 a.m. on Wednesday, Thursday, Friday, Geneva time. We hope you'll be able to make it there. And so I'm going to invite Francois to honor us with the parting words for this evening. Over to you, Francois.
I think it was a great experience shared, and I'm sure many people have enjoyed the detail on how this campaign was agreed upon and how it was implemented step by step, looking at all the aspects of the campaign and taking into account the COVID environment to achieve the result. And I think, as Reda said, I think sharing in the idea engine, the critical element that made this campaign successful, very useful for many. I'm convinced that in the near future, many campaign decisions are going to be on the table. And this experience is a very nice one to illustrate the challenge and the possibility to do well. Thank you for this experience. looking forward to see more experience tomorrow.
Okay, thank you, Francois. Thank you, Shalini Kare, and thank you, Ian Steed, and all of the Scholar team for being there to back us up. And we're looking forward to seeing you tomorrow at same time, same link. Bye for now.
Bye-bye.
Thank you and bye.
Thank you, bye.